The telltale signs of heart disease are classically chest discomfort on exertion, tiredness or fatigue on doing a little bit of exertion, palpitations, and breathlessness on exertion. Signs specific to coronary artery disease are chest discomfort on exertion, which we call as angina. The pain is typically right in the center of the chest. It's like a heaviness or it's like a constricting pain. Patients typically tell us by putting their hands in the center of the chest and sometimes a fist. So this classically implies that the person is having angina, and it is classically on exertion, on climbing stairs or walking uphill. The pain may be localized to the center of the chest or may radiate. Most people understand the radiation to the left arm, which everybody is aware of, but it can radiate to the right arm also. It can radiate to your neck and jaw. It is very specific. When it radiates to the jaw, we understand that it is most likely a coronary artery disease symptom. And it can also radiate to both the shoulders. And this chest discomfort is sometimes associated with breathlessness and or sweating. So if a person is experiencing these symptoms, it is nearly certain that he's having a blockage in one of his arteries which supply blood to the heart. Other telltale signs like fatigue or tiredness happen in people who generally have valve leakages or whose heart pumping is low. Palpitations can also happen in people whose pumping is low or have valve leakages and who have rhythm abnormalities, in which we call as tachycardias, supraventricular and ventricular tachycardias. So these are the classical telltale signs of heart disease. If a patient has any of these above mentioned telltale signs of heart disease, then further evaluation is necessary. We usually get ECG done to see any changes of a previous heart attack or an ongoing heart attack, or sometimes they may just give us abnormal changes which suggest that the patient is likely to have heart disease. If there is blockages found and they are significant, like 80 or 90%, then we open up these blockages with a procedure called angioplasty, in which we first put a wire across the blockage, and on that wire we take a balloon and inflate it, and then we take a stent and implant the stent so that the blockage does not collapse back. So this is the process of treating and evaluating coronary artery disease. Sometimes when the symptoms are not typical, that means a patient is not having classical angina symptoms, then we subject these patients to a stress test. It is classically, we can either do a treadmill test, a stress echocardiogram, or a stress myocardial perfusion imaging study. And when these tests are abnormal, then we take him up for angiogram. And we have also newer modalities by when we do the angiogram. Sometimes the lesions are borderline, that is around 70%. So we are not sure whether we should open them up or not. So we have newer modalities in the cath lab, like FFR, fractional flow reserve, which is like passing a wire with a pressure sensor at a tip across the blockage and checking the pressure ahead of the blockage and before blockage. And that ratio, if it is less than 0.8, we have to open up the vessel. If it is more than that, we can leave it alone. And we also have visualization from inside the arteries of the heart, how much is the blockage, with intravascular ultrasound and OCT, optical coherence tomography. The former uses sound waves and the latter uses light waves to give us the image from inside the coronaries. And these images can tell us how much is the circumferential area of the blockage, from where it starts and where it ends, so that we have our starting and landing point of our stent, and also what is the size of the artery so that we can size the stent accordingly. So with these newer modalities, we can objectively size our stents and place them exactly where we want to. And once they are placed, we can again do a run of OCT and check whether the stent is properly expanded, has it been deployed properly, and how to optimize it further. So with these help of technologies, we are happy to see that the patients are treated the right way.